Hello parents, myself Dr. Anupriya. So this course is all about reflux, what a parent should be knowing. We will divide it into different sections. So first we will understand what is reflux, then what is normal and what is gastroesophageal reflux, the symptoms of reflux, how do we manage it, how do we prevent it, what are the medications we use for reflux, and finally what's the role of diet. So let's get started. So what is reflux? Gastroesophageal reflux is the effortless backflow of stomach contents up into the esophagus or even into the baby's mouth, which happens due to the immaturity of the lower esophageal sphincter. So what is lower esophageal sphincter? It is a muscular ring that acts like a valve between the esophagus and the stomach content and prevents the stomach content from backflowing. In babies, this is often weak or doesn't close properly, due to which there is backflow of stomach contents. Spitting up is a visible sign of reflux. It can range from a small dribble to a more noticeable amount of liquid coming up after feeding. Gastroesophageal reflux is very common in healthy babies and is often a normal part of their development. Next, what is normal spit-ups versus what is gastroesophageal reflux disease? So normal spit-ups happens in an otherwise healthy infant, that is the baby is growing well, the baby is gaining weight well, and spit-ups are usually effortless. It doesn't cause any discomfort to the baby. The baby is just sitting and playing and the spit-up happens, and it is usually mild and the baby is happy and content between the feedings. Now, gastroesophageal reflux disease is a severe form of this spit-ups where it causes troublesome symptoms to the babies and can also have complications. Now, what are the symptoms of gastroesophageal reflux disease? How is it different from normal spit-ups? So here the baby will be having frequent and forceful vomiting, often projectile vomitings, poor weight gain or weight loss, excessively cranky, crying, irritability after feedings, respiratory problems like coughing, wheezing, or even pneumonia. The baby will also have sleep disturbances. Let's see the common symptoms of GERD. So the most obvious sign, frequent spit-ups or vomiting. But remember, the amount may vary from baby to baby. Baby will be cranky, fuzzy, especially after the feedings. The baby will be crying, seems uncomfortable. The stomach acid can irritate the esophagus, due to which there's arching of the back. Reflux can also irritate the airways and can cause respiratory symptoms like cough, wheezing. Baby may pull away from the nipple or refuse to feed due to the discomfort. It can also cause sleep discomfort and makes it hard for the baby to settle. The severity and the combination of symptoms can be different in every baby. Next are the less common symptoms of reflux. So the baby may have a persistent cough, especially during the night. Pneumonia. So aspiration of the stomach contents can lead to lung infection causing pneumonia. In rare cases, reflux is also associated with pause in breathing, especially in premature babies. So the stomach acid can irritate the vocal cords, causing hoarseness of voice. Baby will have poor weight gain or weight loss due to feeding difficulties. So these symptoms are less common and requires careful medical attention to rule out the other causes. Next, how do you manage reflux? So if you're a breastfeeding mom, ensure that your latch is proper. It will reduce air swallowing and in turn reflux. If your latch is not correct, seek help from a lactation consultant. Some mothers find that eliminating certain foods help in reducing reflux like dairy, caffeine, spicy foods. This is often a trial and error. You just eliminate and see if this is helping your baby or not. You can offer frequent, smaller feedings to prevent overfilling of the stomach, in turn reduces reflux. If you're bottle feeding, check that the nipple flow rate is appropriate for baby's age to prevent air gulp. Try to do paced feeding. This will prevent overfeeding and also will help your baby to control the flow of milk. You can discuss formula options with your doctor, like the thickened ones or the hypoallergenic ones if your baby is allergic. Burp the baby after every feed for 15 to 20 minutes. You need to keep the baby upright. You can keep your baby over your shoulders or over your lap to burp. Follow baby's hunger cues to avoid overfeeding. Give smaller, frequent feeds. These will help you reduce the symptoms of reflux, but it may not entirely eliminate reflux. Keep your baby upright for around 20 to 30 minutes post every feed, irrespective of the burps. You can elevate the head end of the crib or can use a wedge pillow underneath. Do not use pillows or roll blankets in the baby's crib. Always place your baby on their back to sleep. Avoid rough and bouncy movements after feeding. Avoid tight-fitting clothes. Dress your baby in loose-fitting clothes to avoid pressure on the tummy. Next are the medications for reflux. When do we use medications? So when these lifestyle changes or the feeding techniques are not effective, and if the baby is having GERD with complications like esophagitis. So what are the medications we use? Firstly, antacids. It neutralizes the acid. Next, H2 blockers or proton pump inhibitors. It reduces the stomach acid production. It is always important to take these medications when it is advised by your doctor. Follow the prescription, the dose advised by your doctor. And these are not long-term solutions. Make sure to follow the conservative measures. There is the lifestyle changes which are very important. Next is rule of diet. So some mothers find that eliminating certain types of foods like dairy, caffeine, spicy foods helps in reducing reflux in their babies. This is often trial and error as already explained. When you're giving formula feeds to your baby, you can go for thickened formulas or hypoallergenic ones after consulting your pediatrician. Starting solids may help in reducing reflux in some babies. So connect with your pediatrician and follow their advice. Avoid the foods that may trigger reflux like acidic foods. Most babies outgrow reflux as their digestive systems mature, which happens around 12 to 18 months of age. And the symptoms usually improve gradually over time. However, you should still be monitoring your baby for any worsening of symptoms. Reflux can be distressing, but it's usually a temporary thing. However, persistent symptoms warrants follow-up. Now, when to seek help? If your baby is having poor weight gain or weight loss, that means the baby is not getting proper nutrition, you need to see your doctor. Forceful or projectile vomiting can indicate pyloric stenosis, which requires immediate medical attention. Bloody or green vomit. Respiratory symptoms like coughing, wheezing, breathing difficulty can indicate aspiration. Baby is extremely irritable and crying inconsolably. Whatever you're trying, the baby is not soothed. Unusual drowsiness or lack of energy. All of these signs need medical attention. Always trust your instincts. You are the first one to see if there is any change in behavior in your baby. Please seek help whenever you feel so.